There's varied levels and degrees of how deep they are, and also it's a fast procedure, right? People show up at the door. We got to get in there. It takes us 6 to 9 minutes most of the times to get the clot out. And the anesthesiologists really try to get people super sleepy, but sometimes we're faster than the medications. Hey guys, welcome to another episode of Brain Buzz, where we delve into the fascinating world of neurosciences and brain health. I'm your host, Dr. Kimon Bekelis.
And I'm your co-host, Jason Wallen.
Today, Jason, we're going to change it a little bit and welcome one of our stroke survivors.
Yeah, well, we have May is a Stroke Awareness Month, so I thought it was a perfect time
That's awesome.
to have our bestowed guest, Christine Newins.
Christine, welcome.
Thank you.
Thank
Blessed
you
to
for
be
being
here.
here. Thank you for being here. So it's been now 8 years since you've been, or almost 8 years since you've been through this adventure, I bet it's been quite the ride. But just for our viewers and listeners who maybe haven't seen you before, maybe haven't heard your story before, do you want to share your story? How did this whole thing start? What happened?
Well, I was in my house and I couldn't walk, and it was weird. And thank God my son was home from school that day. It was actually on Columbus Day.
Okay.
And he came in and he goes, "I have to call the fire department." I'm like, "No, call your father," because I was like, I didn't know what was wrong with me. I couldn't walk. I couldn't get up off the chair. I started not being able to move my arms, and I didn't know at the time. I didn't know I was not able to speak right.
Well, Christine, you look extremely young, so our viewers are probably like, what are we talking about? How old were you when you had your stroke?
I was only, I guess I could say, 52.
Yes, so extremely young.
Yeah, for stroke years, that's really, really young, right?
Well, most people think, Rose from Titanic
Right.
and the movie.
Yeah, no, I mean, and they think correctly, right? So profiling is not bad in medicine. It's good because it leads you to think the appropriate diagnosis. And most strokes will happen, in the sixth, seventh decade of life, 60s and above.
Yeah.
And but Christine was exceptionally young.
But you also had a little more to your story. You kind of skipped a little bit because you were in a horrific accident, correct?
Yes, that's actually what caused the whole stroke. When I was hit by a car in California, I got trauma to my leg besides multiple other injuries. But the main gist of it was the car initially hit me on the back of my leg. And then I went into the windshield, et cetera, And that's before I had this stroke. Like a few days before, my leg was in my calf. It was painful,
Right.
and I didn't know what it was. And I was having it was for a few days that it was painful in my leg, and I just thought it was part of the whole thing of recovery. With my knee is pretty messed up.
Right.
I do have a rod in my tibia and stuff, so I thought it was all part of it, but no, it wasn't.
Right.
And that morning I went down. I remember I went downstairs. And all of a sudden, I'm like, oh, I don't feel, it was just weird. If something was weird. So I sat down and I'm like, and then I couldn't get up. I couldn't move my legs. I couldn't use my arms to get up. And then, like I said, that's when I called my son.
How old was your son at the time?
He was only 19.
Okay.
So he was.
But old enough to help.
Yeah, actually he was a Wanto Fire Department junior. So he took,
no way.
Through the juniors, he took a critical care. It was first responders. It was basically like an EMS light for the kids.
Wow.
So he knew I was having the stroke. I'm like, no, just call Daddy.
So he made the decision to call 911?
No, because
she overruled him.
I was going to
Yes,
say,
I
don't
overruled
always
him.
listen to your parents.
Exactly. So he called my husband, and my husband couldn't even understand. My husband came home from work. He's a physical therapist assistant.
Right.
And my son met him in the driveway. and said, "Mommy's having a stroke," and then the fire department came and stuff, and so Brian knew, and like you said, yes, Mom overruled overruled him.
Not always for the best.
A couple of important lessons here. One, and we say this often, right? If you think you're having a stroke, or if somebody around you thinks you're having a stroke, call 911. That's the first thing to do. Go to the hospital as quickly as possible. Of course, in the case of Christine, she eventually got the care she needed, and her brain had the reserve. She was young at the time and still is, but her brain had the reserve to sustain prolonged exposure to decreased blood flow. But that might not be the case with you. So go to the hospital as quickly as possible. The first thing we do when somebody's having a stroke or we're having a stroke is denial. Very common response,
Yeah.
right? It's not happening to us, especially in somebody who's 50 years old. It's not happening to us, and so we try to find other ways to deal with it. But really, it's better if you go to the hospital and you go through the lengthy process of ruling out a stroke, and then it comes back negative, versus ignoring it and then ending up with a horrendous deficit. I mean, in the case of Christine, if this was not addressed on time, or if there's a deficit, she would have been left unable to move one side of her body, maybe unable to fully make comprehensible speech, and sometimes unable to swallow. And so that would be a catastrophic outcome at the age of 50, or any age, but of course, especially if you're young and you have a long life with these issues, as compared to going to the hospital, getting care, and eventually recovering. But sorry for the interruption, but I thought it was important to know to not delay care.
Yes. So you just got scolded. Sorry.
No.
But it's good for everybody else. We learn from these things.
Indirectly. All right. So the ambulance comes and you're on your way to St. Joe's, right?
Yeah. But honestly, as soon as I saw this one paramedic, I'm like, all right, I'm going to be okay. Because this one guy in the fire department, he is just phenomenal. And then, yes, I went to St. Joe's, and you're having a stroke. No, I'm not. I'm an athlete. That's the thing. I'm an
Right.
athlete. I don't stop. I've done everything, and there's no way. So, yes, I went to St. Joe's. They did whatever, and they sent me, ambulance me to Good Sam.
Sam.
And I do remember the ambulance ride. They gave me the TPA, which obviously didn't. What I ended up having to have done didn't really work. But I'm like, oh, look, I can move my arm now. I remembered saying that in the ambulance.
Right.
And then I got to Good Sam, and I just remember it was like miles that they wailed all different corridors to finally get to Dr. Bekelis.
So just I'm gonna editorialize a little bit for our viewers. So what happened to Christine is she got the clot busting medicine, the TPA at the time. Now we use TNK, and that in large blood vessels that are blocked is only 30% effective. So it can open the blood vessels only about a third of the time, and the majority of the times it doesn't, and that's kind of where neurointervention jumps in to unclog those blood vessels that are causing the stroke. And in your case, actually, what you had is a middle cerebral artery occlusion, which is a common type of large vessel stroke, and that's why half of your body wasn't moving very well. And in those cases, when your blood pressure is elevated, and your body tends to push your blood pressure as a response to maintaining some sort of blood flow into the brain, when your blood pressure is elevated, you can have improvement of symptoms. So we call it thresholding. So you push your blood pressure, you go through other blood vessels over and around blockage, bypass the blockage, so to speak, and your body is able to move again. But that's just a temporary response. Given enough time, if left untreated, that goes down again, and that's what you were having.
Mm-hmm.
When we did the CT angiogram and the CT perfusion, the brain was still ischemic or starving for oxygen or blood. The blockage was still there, but because of your blood pressure going up, you were able to again move the arm. So you're experiencing that, which is a good thing. That means that you had other paths to get the blood there. So your brain was staying alive.
Yeah.
kind of on life support until you got revascularized. And I remember I met you in the emergency room because, I tend not to necessarily go to the emergency room when we have these large vessel occlusions. We wait in the angio suite where they bring the patient and we meet them there. But I remember my nurse practitioner and I were in the emergency room in your case because you were so young, and we were in disbelief also. Believe it or not, So denial is not exclusive to patients; it applies to physicians too. More frequently to physicians than patients. And so we were there to just examine you and see what was going on. And I distinctly remember seeing you in the emergency room. Of course, then we brought you over to the angio suite. And
What do you remember about
yeah.
the treatment?
Oh, the actual.
What we call the surgery, mechanical thrombectomy.
Oh, I was completely awake. I remember that like it was yesterday.
Do tell.
I do. I was laying there and I remembered you put the thing in my femoral artery.
Yes.
And I was laying there and my leg was moving. It has to do with the accident. My leg would like spaz a little bit, and you're like, keep your leg straight. I'm thinking, put a strap on it. But and then I do remember something going into my head, and I do remember saying, "Ouch."
Right. So again, I'm going to editorialize. So Christine is referring to the sheath or the special IV we place in the groin. That's our access site to navigate through the arteries all the way into the brain and get that clot. Now, what Christine is referring to, something going into the brain, is the initial feeling of the contrast. As we inject contrast, that gives you that warm sensation like a rush in your brain, and you have that impression. So we use the contrast to visualize where the blood vessels are, and then when you said ouch is when we pulled the clot out. So the act of pulling the clot out, blood vessels have a bit of a sensory component, so she felt that pulling of the clot, which is pretty amazing. Not a lot of people are awake enough to experience all that, but it's awesome that we have you here kind of telling that story. And people do get what's called sedation, twilight, very similar to a colonoscopy, but there's varied levels and degrees of how deep they are, and also it's a fast procedure, right? People show up at the door, we got to get in there. It takes us 6 to 9 minutes most of the times to get the clot out. And the anesthesiologists really try to get people super sleepy, but sometimes we're faster than the medications.
I remembered everything. I was completely awake, which was thinking about it weird.
Yeah.
Like I was there. I was there.
So then you said ow, and then the thing was out, the clot. And do you remember feeling different?
I don't remember feeling different. I know I burst out crying.
Right.
With all that I went through, I'm like, oh, and it was like it was done, and it was like more of a relief that everything was good. And then, eventually got into the neuro ICU, and I was fine.
Right.
I think in the middle of the night I had got a headache,
Right.
and they took me down just to make sure everything was good. But I was, I was able to get up and go to the bathroom, and I had visitors, and the neuro ICU was a good experience. It was just everything went well.
Right.
From that.
And that's the difference, right? When you're able to get these procedures that allow your brain again to function and be normal, and you're like, what am I doing here? I need to go home now. That's a good sign, because of course the alternative, like we discussed before, where you have permanent weakness and inability to speak, and you're in the ICU getting a peg tube for feeding and other stuff, very, very different outcome. And of course, had this happened 5 years before it did, I'm not sure that necessarily you would have gotten this treatment. This treatment at the time was in its infancy, and became the standard of care about 8 years ago. And about 6 months into that, you had your stroke. So
Good timing.
Yeah,
good
that's right.
timing, right? It's bad timing to have a stroke at any time, but that was a bit of a blessing in disguise about the timing of when it happened, and the ability, to have an established program pretty much in your backyard, to go from St. Joseph's, get the TPA, which is the right thing to do, go to Good Sam, and you pretty much were exposed to every single emergent care that we have, and that's knock wood.
Yeah. So you said you felt normal in the ICU, but obviously, so at what point or what didn't feel normal compared to pre-stroke? Because you've been coming to the support group. You went through a lot of highs and lows with the recovery. So it was great. You felt much better. But at what point did you say something's not right? And what was it?
Oh, I had the weakness.
Okay.
And I definitely, my speech was not right at the good spot. I would see, I eventually did go after I left the hospital. After a few days, I got there Monday. I left Friday. I had him home for like just a week, and then I went to outpatient. And that's where I got OT, PT, and speech. And that's the speech because I used to see just speaking to anybody, I would just see a whiteboard with no words, and I
Right.
wouldn't be like, I wouldn't know what to say.
Right.
So with the speech and OT, it was all weakness, more so on my upper body, on my right side. And I guess it was on my right leg also, but I was focusing on my left leg because of the injuries that I had. But definitely going to OT helped and everything, and it was just long process. I mean, I am still recovering. It's not that I'm giving up. I'm learning. I've learned the hard way not to try so hard.
Right.
But that mentality took you through, especially early on, when you hit a barrier. Because I mean, like I said, you've been coming to support group, so I've heard you tell other patients time and time again when they wanted to give up that you have to look for another outlet. You have to kind of, but you were a little hard on yourself because you have that athlete mentality. So you wanted things to happen yesterday, and when you couldn't do something, you were beating yourself up on. So you had to find that happy medium, right?
Yes, I mean it was, I used to be able to do this, and then I couldn't do that. So that was an adjustment. But I worked hard. Like I said, I wasn't gonna give up. And the first thing was though, I actually had to take a road test to make sure I could even drive. So that was a
Right.
big to do. That okay, I have some independence back with being able to drive, but it was also to make sure that I was able to. I knew I was able to, but just to give everybody else
Yeah, for the,
the comfort,
safety
that
of
I
others.
can do that. But and there's still things that I've learned. Even just going shopping. It used to be where I'd go and I'd be exhausted. I couldn't even put the stuff away. And even going down the aisles, I'd have to be careful with going down the aisles. If I was looking left, right too quickly, I'd get dizzy. But that's my main thing. That's the only issue I have. Thank God I'm walking and talking. I am so blessed. I mean, I never had to have a wheelchair or anything like that. And the speech, it's coming. Once in a while, I lose my words, but nothing like I see the
Happens
whiteboard.
to everybody.
I know, but that's also what, right? Yeah, honestly, that's my issue right now because I think that it's the stroke sometimes, but I'm like, wait, I am 60 now, and I'm like, wait, I have to get used to getting old, I guess.
Yeah. One story that you tell, and I think it's great for people, and I use a lot of the examples because you're very articulate and also kind of getting the point across, is that you were, when you first started going shopping again, and you were in the supermarket, and then you went down that cereal aisle. And all the colors and the lights, and you just left the cart and walked out. And I said, sometimes you have to just leave the cart.
Yeah.
That's what I say. I give that advice to some new people that come. Sometimes you just got to leave that cart and come back later.
That's a pretty intense aisle.
Yeah.
But listen, in all honesty, that's another important lesson, right? I think you coming here and speaking will help a lot of people with their recovery also. But one of the important messages that you just conveyed is that it's a marathon, it's not a sprint, right? It's not, of course, we all want to get better yesterday, especially younger people, type A personalities, athletes. It takes a little bit of time. And your best bet of full recovery is to keep working on the deficiencies that you have. And some of those deficiencies are visible, right? Your strength is diminished, your speech is not perfect, but some we can't measure. And that's where the support group comes into place. We say, of course, a lot of the stress and damage from a stroke or any sort of traumatic near-death experience is emotional. And, I can examine you and say, oh, great, your strength is perfect, your speech sounds good, see you in 6 months, which is something us doctors do. But then the emotional aspect is tough to quantify. And sometimes you cannot even tell that that's what's going on. And the trauma to you, but to your family, right? Imagine your husband, your son, they were kind of first responders to this episode. So they, I'm sure, were traumatized also. Every time you were sick, I'm sure they were worried that something is going to happen for a bit. Now I'm sure they're. But
No, my son, he was young. I mean, like I said, he was 19. It was last year I was talking to him. He goes, he keeps thinking I'm going to have another stroke. I'm like, oh no, I'm not. I'm like, no, I'm not.
She is not.
I'm doing everything I'm supposed to do, and it was just a freak thing,
That's
I'm
right.
like, no. So he's going through he's been going through some stuff with that.
Yeah, I mean, no doubt. And so that's why support groups are important.
Yeah,
And
bring them a
Jason-
support group.
and Jason is running, of course, our support group. But support group is important for the patients. It's important for the families. Common response we get sometimes from patients is, I'm fine, I don't want to go. That's another part of denial. I always say just go once, and if it's not for you, it's fine. But just go once to see what it's all about. You see people there like Christine who will take you through her story, and you'll relate. There's no doubt you will, because you've been through a similar experience, and then they'll jar up some other questions and share coping mechanisms. Very important. And sometimes the patients don't want to come, but the family members want to come, right? So we have just family
absolutely.
members, and sometimes the opposite. And so support group, I think, is very important. And one of the first things we did, actually, when we started the Stroke and Brain Aneurysm Center of Long Island, was to have a support group available.
Within 3 months, I believe.
Yeah, available for these patients. Very, very, very important. And so, of course, support group, I would say you're a big part of that support group. How has that helped you with your recovery? I know how it helped others, your presence, and everybody's been very grateful for what you've contributed. But what have you gotten out?
I get back given to people because I feel with my I am so positive at this point. I know I'm going to get better eventually. And when people come in and they're so down, I'm like, no, don't be, I'm like trying to, I would never wanted to be a cheerleader, but I feel like sometimes I'm a cheerleader.
No, more like a coach. You're helping them.
That's better. Better wording, yes, a coach. Plus, I get to see certain people again. They and seeing how they also get better. And the thing is, I'm not so bad. And I feel bad. Some of the stroke patients are, they're in the wheelchair but you see them getting better themselves.
Right.
But just with what I went through and how I am blessed. I mean, I am pretty good. So.
How has this traumatic experience, of course, we see people with near-death experiences, kind of their life changes in some way. Have you changed your life in any way, or your perception of life, or what your priorities are by having this experience at all?
I'm not so competitive. I used to be,
tell us about, you were an athlete, you're playing volleyball, right?
Yeah.
So tell us about that.
Yeah, I played volleyball at Hofstra. I'm in the Hall of Fame.
All right.
I have a lot. I do have a. I still have.
Small thing.
Yeah.
I still have the serving ace record, so that's a good thing. The
Right.
other ones, the records are to be broken. So there's other stuff that I've been going down the list. But my competitive, like when my kids were little, I wouldn't let them win. We played. I remembered playing street hockey in our driveway with my older son Patrick, and we'd play, just fun and stuff. And then as soon as he hit me in the ankles with the stick, I was done. That's it. All right, we're done.
But that competitiveness helped you in your recovery process, don't you think?
Yes.
But also, what she's saying is that
Yeah, you
know,
learn.
She realized that in life there's a lot more to just winning.
Yes.
Yeah.
It's not. Yeah, it's not. It's more about the experience and not having to win.
Yes.
And that changed with me. I'll play for fun. I don't
Yeah.
have to win.
Well, even like so your determination through your process, you were determined to ride a bike, and then you had an incident with the bike, and then you switched to a tricycle. I want to say tricycle, but I guess is that what it's called? I
No,
don't-
it's a recumbent trike.
Okay, there you go.
Come on,
but
Jason.
you did that with humility, because you said, you know what, this is just going to be better for me, better for my family, and that I think that was part of your growth, is that instead of just okay, like it was great that you were determined to get back on a bike. You did it for a while. When you hit another snag, instead of just getting back on the horse, so to speak, you made some modifications that made things easier and safer.
Oh, definitely safer because I'm dizzy still. That
Yeah.
could be from the stroke, but also the brain injury from the accident.
Right.
So I'm not sure, but it has gotten better. But I know I have to stop with certain things, and it happens almost every day, depending upon whatever. But with the recumbent bike, at least I'm balanced. I have 3 wheels, so I'm not gonna just tip over. So in this way, I could go and as long as I want to, and just turn around and come back. And with the recumbent trike, I put on my car, so I don't have to really worry about getting home. So, but it just finding other ways to just enjoy life and get through some things.
Yeah. If you could give one advice to anybody who, because I unfortunately we see stroke patients younger and younger. I mean, in support group recently, what would be the biggest advice that you would hand down to someone?
And by the way, before you answer, your advice is important because a lot of people see where you are now, and you're to some extent the role model for a lot of these.
She's my gold star patient. I tell her that all the time, and I use her as an example in support group.
Right.
Because we were able to watch through almost 8 years the highs and the lows that you've had.
Right. So people will listen to you. So the floor is yours.
Never give up, and doesn't matter what the doctors tell you. Never give up. I was told by a doctor that, you're as good as you're going to get, and then I
Right.
went back in 6 months to get checked out, and he's like, "Oh, you are getting better." That's never give up, and just find something else. Find other things to do to help you. In my house, I have a bunch of stuff to help me with recovery.
Right.
And now I have a rowing machine. So I'm completely balanced on this rowing machine, and I could go as far as I want and stop. And I'm right home. So it never give up. And I know, Jason, you've always said, always look back to see where you were. And that's, I don't think people do that because they're just in the moment. And meanwhile, like, I can drive now, and I can do this now, and yeah, I'm on my recumbent bike, so I can ride again the way I used to. Well, not as far, but it's okay. I was able to. It's not how far or how long. It's I was able to still do it. Yeah. So it's really every moment that you're able to do something, you really have to give yourself a pat on the back that you were able to do it.
Yeah, I think people, I do say, look to see your progress and where you've come, but I think people tend to look too far back to before the stroke, and they use that as their baseline instead of, I was doing this, and then I had this issue, and then now during the like you said, I was not able to do this. Now I'm able to do this. I was not able to do this. Now I'm not able. I am able to do this. And people, keep on wanting to go back to the way things were, and get upset that they're not there, as opposed to looking at how you had said.
Yeah, it's just the little adjustments. Yeah. I had to do a bunch of carrots for my mom, to bring from my parents' house for Mother's Day. I can't stand there and do the carrots, so I sat. And this way I could get as many carrots as I can.
Yeah.
So you heard it here. I think that's the most important message. Yeah. Never give up when it comes to recovery of neurologic conditions, stroke, brain aneurysms. You know it. Christine, thank you.
Oh no, thank you. And stay positive. That's another big thing. Yeah, thank you. Thank you for inviting me here.
Absolutely.
Our pleasure. Really inspirational to have you here. Thank you, and thank you guys for watching. We'll catch you again on another video. Take care.